Tips for physical therapists from prosthetists. Shh. I'm letting you in on a little secret. That's not so secret. Prosthetic feet don't really bend at the ankles when you're not walking on them. So, teach your patients to just kick their leg out when they're sitting and not worry about the fact that the toes are sticking up. So yeah, there are some prosthetic feet and ankles that have some motion. For those patients, you want to teach them how to plantar flex the foot as much as possible, but all of those don't have really adequate range the way that we normally behave when we're sitting. So their toes are going to be sitting up when they're sitting down. So try to make sure that your patient's comfortable with that. And part of the reason why we want generally for them to have their leg out in front of them is it's just going to be more comfortable. Now, the socket designs that we use are set up for comfortable sitting, so they're not going to impinge on the back of the patient's leg while they're sitting, but it's still going to be the case that their knee sleeve or their liner does put some tensioning force on their limb while they're sitting. So if they just get in the habit of kicking their leg out a little bit while they're sitting, they're going to be more comfortable. Now, in some cases, socket design for transtibial patients is going to be where there absolutely positively is pressure at the back of the knee when the patient's sitting, or it might even be the case that the back of the knee in the prosthesis is high enough that it puts significant pressure in sitting. So by making sure that those patients know to just kick their leg out when they're sitting down, you'll keep them a lot more comfortable. So finding the right place at the table, making sure that they, get that out no matter what leg might be in the way, and getting them comfortable with the fact that yes, your toes are going to be sticking up while you're doing that. All important things to make sure that your patients are comfortable while seated. Now, if your patients are still using a wheelchair, this is one of the things you got to be thoughtful about. So, making sure that when they don't have to have their feet up, that they put the foot plate up and get the foot out is helpful. Knowing that they can put just the heel on the foot plate. If they have footrests that can raise, sometimes raising that up a little bit would help as well. So I hope it helps you to realize that these things don't just flatten out when you sit. I hope it helps you to realize that, oh yeah, depending on what's going on around the knee, might be crucial to make sure that they are out when they're sitting. And that you can support your patient in just understanding that, yep, prosthetic feet don't do that. So your toes going to be up when you're sitting. Wish you well. Bye.